Hello, my name is Dr. William Soscia. I'm the Medical Director at Center for Sight in Sarasota. My specialty is laser cataract and refractive surgery. Laser cataract surgery has been the latest buzz for about the last 10 years. With the femtosecond laser, which is the wavelength at which the laser works at, our safe, effective procedure has become incredibly safe and incredibly effective. We're able to not only treat cataracts like we normally have in the past, but do so in a precise way to give folks the option not to have to wear glasses. The laser part of that procedure is very instrumental in helping that become a reality. One of the great things about our field, which I've loved for now over 25 years, is our field rapidly advances in technology. And when we're asked this question, what's the latest and greatest, we almost have an answer every year. Particularly being able to work at Center for Sight as the medical director and being involved in clinical studies and being on top, really, I would say the tip of the spear, if you will, for when it comes to technologies. We use what are called multifocal technologies, which most people don't know have really been around since the late 1990s. They were not used very often because the technology was raw. The ability to calculate the correct powers wasn't as good as what we have now, and we didn't have the femtosecond laser. So the current and most recent multifocal technology that we're using is from Johnson & Johnson called the Odyssey lens. The Odyssey lens is really what I would call a 5th to 6th generation technology that gives us a true full range of vision and minimal to almost no side effects, minus some of the rings around lights that we do see at night with all of the multifocal technologies. The other thing that's been very exciting for us here at the center is the light adjustable lens technology. This is a technology where we're able to make fine-tune adjustments to patients within 4 to 6 weeks after their original surgeries to really dial their prescriptions into exactly how they like it. This is particularly helpful and effective in patients who've had previous surgeries like LASIK, PRK, RK, and even for patients who haven't had those technologies. So in summary, you can see there are so many options for patients, and we really try to sit down with you and look at what your goals are, number one, and then number two, match that to some of the specific objective parameters to give you the absolute best technology. When I get asked the question why I chose my specialty of cataract surgery or being a laser cataract and refractive surgeon, which I'll go into a little bit here, it's actually interesting because I was certain from the day that I got out of the military till almost my last year in medical school that I was going to be an orthopedic surgeon. Did research in it, could tell you everything about orthopedic surgery, just absolutely loved it. Watched over 200 procedures. I was ready to go. And then I saw cataract operation, ironically, of our founding partner here, Dr. David Shoemaker. I spent a morning with him watching him do cataract surgery. And at that moment, I said, not only am I going to be an eye surgeon, an ophthalmologist, but I'm going to be a cataract surgeon. And I've held to this day, and I made the absolute best decision. I mentioned earlier on some other videos how much I love taking care of patients and restoring their sight when I fix their cataracts, and I absolutely love the technology. As a laser cataract surgeon, as I also mentioned in some previous talks, I utilize the femtosecond laser, which is a new advancement in the last 10 years. Some practices throughout the country which still haven't incorporated the technology, taking, again, a very safe, effective procedure and making it amazingly safe and effective, and also enhancing our ability to reduce people's dependence on glasses. I believe at this point, I've done over 50,000 of these procedures myself and probably have as much or more experience than anybody in the world with the femtosecond laser in conjunction with cataract surgery. And it's really nice, the refractive surgery component. Cataract surgery now has become refractive surgery. Refractive surgery basically means any surgery that helps you to reduce your dependence on glasses. Simple. Just like LASIK surgery, which I also was part of my fellowship that I did and still perform quite a bit of LASIK, perhaps not as much as cataract surgery based on the market that I'm in here in Sarasota.